Clinical Pharmacy Adherence Optimization Part 3. In this video, I'm going to talk about how to assess adherence. Before effective strategies can be devised to improve adherence, pharmacists need to evaluate the following. First, if patient is adhering to pharmacotherapy plan. Second, risk factors that may predispose the individual to non-adherence. Risk factors such as asymptomatic conditions, chronic conditions, cognitive impairments, especially forgetfulness, complex regimens, multiple daily doses, patient fears and concerns related to medication effects, poor communication between patients and practitioners, and psychiatric illness. Can we assess non-adherence? Yes, we can. There are two methods to assess non-adherence: direct method and indirect method. Direct methods, they are objective methods for assessing non-adherence, and it includes the following: the blood level monitoring, urine assay for the measurement of drug metabolites or marker compounds. Is this method applicable for all the patients and all the drugs? The answer is no. So what are the limitations of the direct methods? The first limitation, when collecting blood or urine samples, it can be expensive and inconvenient for patients. Second, only limited number of drugs can be monitored in this way. Third, the ability of direct methods to identify non-adherence depends on the accuracy of the test and the degree to which the patient was non-adherent before the urine or blood samples was taken. Fourth, there are many factors affecting the correlation between drug levels in blood or urine with adherence, such as bioavailability and completeness of the absorption of various drugs. Fifth limitation is the rate of metabolism and excretion of the drugs. The second method is the indirect methods, and these methods include the following: first, patient interviews, pill counts, refill records, and measurement of health outcomes. Let us talk about the first one, patient interviews. This method identifies 80% of non-adherent patients. It is an inexpensive method. It allows pharmacists to show concern for the patient. It provides immediate feedback, so these are considered as advantage. So what are the cons or disadvantage or the drawbacks of this method? It can overestimate adherence. Its accuracy depends on the patient's cognitive abilities, patient's honesty of his or her replies, as well as the interviewer's correct interpretation of responses. What about the pill count? The advantage of pill counts method: it is considered as objective measure of the quantity of drug taken over a given time of period. What about the disadvantage? This method is time consuming and assumes that medication not in the container was consumed by the patient. Refill records is another method for measurements of non-adherence. Again, the refill record provides an objective measure of quantities obtained at given intervals, while the disadvantage, it assumes that the patient obtained the medication only from one source and they record only their source. Thank you and wish you a best and good luck.